So I'll go and start on the safety side, and as Christine mentioned, she'll speak to the human resources side of the our COVID response here in California in particular. So just to quickly introduce myself, my name is Jason Arvizu. I'm with Arthur and Hansen. We're a safety, environmental, and risk management organization here in Bakersfield, California, primarily supporting the Kern County Builders Exchange, but other exchanges throughout California. A little bit of background about me. Been working in safety in the public and private sector for about 15 years now when it comes to COVID. One of the oil and gas companies here in town that I've worked with back in February, I was over on a project in Kazakhstan, got off the plane in February and was told, hey, there's this little COVID thing coming up. We don't think it's going to be a big deal, but can you go ahead and help stand up our crisis management team and run our response? 3 months later, a crisis management team of over 200 people got to go home and hand it off to somebody else, but learned a lot about COVID, especially very early on in that response, and hopefully can share some of those learnings and best practices to you all to be able to manage your own response in organizations. As part of that, one of the things that we've put together is a guidance document that is intended to try to simplify the updated standards that were recently released by Cal OSHA. So I'll share that on the screen here in a second. But to guide the discussion part of this before we open it up to Q&A, which I want to be able to have as much time as possible for Q&A. The new OSHA standards are roughly 21 pages. The guidance document that we're going to go through is a distilled down version of that that tries to simplify it as much as possible. And we took a construction industry focus on this, just given our partnership with the Kern County Builders Exchange, but really under these general industry safety orders, this applies to most organizations, and then there's certain elements that would be specific to the type of operation that you run. But I'm going to preface this by saying that obviously whenever you take something that is the core standard and then you simplify it and apply it in a way to where you're trying to be 80-20 and what's the most critical things that a company needs to know and implement, there are things that are not overly detailed reflected in here that relate back to the standard. And so like anything else with safety, risk management, human resources, et cetera, it's a matter of taking the standard, understanding your operations, and then where the two applied for you to be able to take those controls, implement them into your organization to be able to manage that risk on either the safety or HR compliance side of it. So as we go through, again, if there's any questions, please feel free to ask them in the Q&A function down at the bottom part of your screen, right about here. And then at the end of the safety side of it, I'll go through any safety related questions, and then Christine will go to the human resources side of it, and then any HR related questions, and we'll be able to work through, and if we run longer than the hour to be able to continue to answer questions, happy to do that. All right, so I'm going to share my screen with y'all.
Clarify here, these are technically temporary standards that have been issued by Cal OSHA. We've all seen in the last year how this is a ever-changing response for us. Our understanding of COVID, the impacts of it are all factors that are causing what's expected of us to constantly be changing and in flux. So we're trying to keep this as updated as possible as new information comes out. But this is primarily going to focus on the new standards that came out from Cal OSHA November 30th. And it's broken up into a few different high-level categories. One of them is the COVID prevention side of it, which really is focusing on what are the expectations for employers to establish COVID prevention plans. And as with any plan, what are the main components of that plan, primarily focusing on how do you put in controls or safeguards to prevent the transmission and the consequences of COVID for your workforce. There's also some additional guidance that was put out by Cal OSHA of how to handle what they're calling outbreaks. That includes 2 tranches of outbreaks when you have 3 or more employees, and then a second category of a major outbreak, which is when you break the 20 employee threshold on a work site. We'll get into a few nuances about what's meant by work site, et cetera. And then also additional prevention guidance on employee provided housing. Not as much of a factor here. In Kazakhstan, we worked in a camp setting, so that was actually one of the most significant factors for transmission potential for us. But what we're seeing here in California, it's not as much of a factor. But this last category is one thing to really focus on, because this is where we're seeing a lot of spread occurring in the workforce, and that's in transportation. So there's some guidance here on how to manage transmission potential for employer provided transportation as well. So when we get into the updated safety orders, one of the key things for the COVID response from Cal OSHA is the expectation of having a written COVID-19 prevention plan. So fortunately for us as organizations falling under Cal OSHA's jurisdiction, when it comes to injury illness prevention programs and then supporting plans like heat illness, silica, et cetera, this generally isn't going to be new to us. It's a matter of just taking a plan specific for managing risks for COVID-19 in our workforce, and then folding that into whatever safety management system or IIPP that we have as an organization. And you'll see the subcategories that we're going to go through here on what does that plan need to include, mirrors what most other plans would generally look like. The major components in any safety plan being, do we understand what's required of us and does it apply to us? Did we write down what our plan is to where it's accessible by our workforce? Have we communicated it to our workforce to make sure that there's a means of them to understand what's required of them, and to provide feedback back to management within the company or organization? Have we identified what are the specific risks? In this case, the likelihood of potential for COVID transmission within our organization? Do we have a set of controls based on what the standards are of how we're applying them in our workforce to prevent transmission, to manage those risks where we believe COVID's transmission is likely going to happen? And do we have a method for going out and being able to inspect and assess that those controls are in place, functioning and working to prevent the potential for transmission? And then at the end of it, if we do have a case, do we have a method for us to be able to go and investigate what may have led to that transmission occurring? And is there an opportunity for us to improve controls to prevent a repeat incident or COVID case from occurring? And then all that being rolled up into understanding the record keeping requirements for that plan, et cetera. So at a very high level summary, look at it as a management system, just like you would with any other safety management system or IIPP that you would have for your company. So the first part for the COVID side of it is having a means for communicating. Really nothing new here. And the objective is to be able to leverage whatever existing communication channels you've established for your safety program within your company. This could be safety committee meetings, postings, any other activities that you do as management or leaders within your organization to communicate expectations and requirements for your safety program, and also be able to get input and feedback from your workforce as well of how to improve that or any gaps that they may see. The next part is identification and evaluation of COVID-19 hazards. Think of this very much in the same way of how you would conduct your hazard assessment element within your IIPP. For the type of work that we do as an organization, what is the profile of likely COVID transmission that we need to address before we start thinking about what controls or how we're going to apply controls for us as an organization? So for example, if you're working in the retail or restaurant business that has a high likelihood of exposure potential coming from the public, and a very specific way that you interact with the public, and the material or equipment that you use in the case of a restaurant, silverware, food, all these things that are going to be potential transmission points, you're going to apply controls to reduce transmission potential in a very different way than you would if you're a construction company working on a job site to where there's no public access, and you have to consider, how am I managing transmission potential that may be coming from one company to another company working on a multi-employer job site, for example. You wouldn't apply the controls for a retail or restaurant in the same way that you would apply the controls for a construction or manufacturing operation. And so that's where you get into the identification of an evaluation of COVID-19 hazards. How are we likely going to have transmission come into my workforce? And when and if it comes into my workforce, how do we limit the potential of transmission amongst our workforce to reduce the overall consequence if transmission does start to occur, and to prevent it from becoming an outbreak? If you do have an outbreak, that brings us to the next section, or cases or an outbreak, that brings us to the next section that's required within your plan: having a means to investigate and respond to a COVID-19 case within your workforce. So again, your IIPP already has a incident and illness investigation element to it. Now this is just taking what are the specific expectations from Cal OSHA for COVID and just layering it into the plan, but then you're going to be responding to that in the same way that you respond to most investigations within, if you had an incident for an occupational safety related injury, in the same way that you would respond to an illness from COVID transmission. One important factor here, though, is when we talk about investigations for COVID, et cetera, we all see that spread is happening. Even if you, I'm sure we all have examples of people that we know that have been following the requirements around mask use and social distancing and minimizing the potential for exposure, and they still end up getting it. So it's not about blaming anybody for getting COVID. If you do have a case in your workforce, it's wanting to understand and learn from it and see where do we have opportunities to be able to reduce the likelihood of having a repeat incident occur by improving the controls that we put in place. And then that goes back to the next element around correction of hazards based on the severity of the hazard. So this, again, relating it back to the IPP, your hazard assessment program, but then your hazard correction element within your IIPP. If you do have an incident and the outcomes of the investigation of how that transmission potentially occurred and what are the controls that we need to improve, documenting that on a hazard correction log. It also goes back to the aspect of having a hazard assessment program where you're going out and then doing visiting work sites, making sure that the controls that you're putting in place are being followed, the behaviors and habits that you expect of your workforce are being adhered to, seeking input of how it can be improved through whatever existing inspection or assessment or audit program that you may have, and then just taking those findings and then using them to, again, learn and improve and see where can we improve the controls for COVID transmission. The next element is training. There's some very specific training content that Cal OSHA has stipulated that needs to be provided to employees, in addition to training your workforce on what are the requirements within your specific COVID-19 prevention plan as a company. I won't go into every single element. It's in the guidance document that we'll send you as well. But really it's focusing on the core training is what are the habits and behaviors that we expect of employees or anybody to prevent COVID transmission around physical distancing, mask use, hygiene, and again, what other additional controls that are specific to your organization based on what's in your COVID-19 plan. So to relate it to another parallel that a lot of us would be familiar with, a heat illness prevention plan as an organization. When you conduct your training for heat illness as a company, what's expected of you by Cal OSHA is to not just train on the baseline content of heat illness, of understanding the signs, symptoms, et cetera, but also what are the specific controls and expectations of how you apply that as a company by sharing your heat illness prevention plan as part of that training as well. The next group of subcategories within COVID prevention starts to get into the specific controls that need to be within that plan. Again, physical distancing being one of the most effective ones. There's some specific guidance provided by Cal OSHA within the standard of how to consider applying that in your company. But then again, depending on the type of the work that you do, it may be easier to apply physical distancing for some trades versus others. But your plan just has to be able to demonstrate how are you applying physical distancing as control specific to your operations and where you believe that COVID transmission is likely to occur. The next subcategory is looking at face coverings and making sure that they are being worn correctly. A few things to highlight here, specific to the updated temporary standards that came out on the 30th. It's clarifying that face shields should be used in combination with face coverings. They're not a substitute. So that's one thing that's come up with a lot of companies that we work with, of using face shields in lieu of or instead of having a face covering. You're not able to use only a face shield. You have to use some sort of face covering. There's still some exemptions for that. We won't dive into that rabbit hole right now, but if you do have questions on exploring those exemptions, feel free to reach out to us and we can talk through those separately. The other key question that comes up when it comes to face coverings is how does it apply to a respiratory protection program that some of us are probably familiar with, depending on the type of work that you do as a trade. There's a lot of nuance there to cut through depending on the type of work that you do and how you approach your face covering controls as a company. But it is not automatic. The use of face coverings does not automatically cause your company to have to put your employees into a respiratory protection program. Say as if you were expecting and requiring employees to wear an N95 mask, which would technically be a respirator for more than 30 days, and the rest of the medical surveillance requirements, et cetera. So go ahead and refer to the guidance documentation. If there's more questions, just let us know. Or if you do have a question for this forum, please feel free to bring it up and we can try to talk through it at a very high level. The next subcategory is looking at other controls and best practices that you want to apply as essentially safe work practices within your organization for prevention of COVID transmission. What's nice is the way that the standard has been written is it's not as heavy-handed as some people have expected of what's being required by employers. They are giving some latitude to employers and organizations to determine what controls they want to put in place and how they want to put them in place. But like within the safety and risk management space, we look at things like the hierarchy of controls for the risk that we have. When we determine what are the controls that we want to put in place, we work our way from, is there a way that we can just eliminate the hazard altogether? Is there a way that we can engineer out the likelihood of that hazard or the mitigation of that hazard? Can we look at administrative controls such as how we plan work or the procedures that guide the work and decisions and actions of our employees to prevent that hazard? And then ultimately, is there an element of personal protective equipment that is used to help protect your workforce from those hazards as well? Again, there's a few items in within the standard that are required. So we just named a few around physical distancing and face coverings as an example of personal protective equipment that needs to be in there. But when, as a company, you are putting together your required COVID prevention plan, this is the element to where you're going to demonstrate this is where we believe transmission is going to occur, and these are the steps and work practices and the controls that we're putting in place in order to prevent that transmission from occurring in that instance. The next aspect is reporting, record keeping, and access. When we talk about record keeping and documentation, that ranges everywhere from having an actual plan in the first place to the elements within that plan that you're using for documenting your inspections. How are you documenting outcomes of investigations if you do have a COVID case, any sort of hazard correction log that you may be keeping for documenting corrective actions and tracking them to closure. Those are all examples of record keeping kind of being rolled into one component or element within the COVID standards. I know when we talk about an IIPP record keeping, we're generally looking at also reporting on our OSHA 300 logs for any sort of recordable injury or illness, et cetera. That is absolutely a component of your COVID plan as well. But I would encourage you to think about record keeping as your documentation as a whole of how you're managing your COVID risks. The other element to this in record keeping, and this is really going to come into play to where if you do have a case, to limit the impact of other potential exposures, especially if you're on multi-employer work sites, is record keeping of where your employees are working and on what days, to where if you do have a case and you're evaluating what is the potential for other COVID exposures to that index case that you have in your workforce, by doing that record keeping of what employees have been on this project site or who's been in the office and who hasn't, that's going to be pretty critical for you to be able to demonstrate who's going to fall into the subsequent testing and exposure assessment compared to just having everyone rolled into and being treated the same way if you're not able to document where with reasonable certainty can you demonstrate who was where and who potentially would have been exposed to that index case. So again, just another key element specific to the development of a COVID prevention plan of record keeping, having some sort of like a site roster and being able to demonstrate where your workforce is interfacing with other personnel within your workforce or other contractors on a multi-employer site. That's a pretty key aspect of record keeping for your COVID plan. There's some exclusions for COVID-19 cases. I'm not going to dive into this because a lot of these are very much dependent on the circumstances around that potential case. If you do have specific questions, or if you do have a case that you would like some support with evaluating and seeing how to approach it, please feel free to reach out to us separately. But I do want to dive into this next element around return to work criteria. When we're talking about having a case or a potential exposure, at some point that employee, we want them to be able to return to work as safely and as quickly as possible. So the updated standards have put together some more prescriptive guidance or some more prescriptive requirements around bringing back a positive case, as well as some additional direction between whether that case was symptomatic, presenting symptoms, or asymptomatic, not presenting symptoms. One of the key things here is testing as quickly as possible, and as soon as you can, as soon as you have documentation of when that test specimen was collected, even if it's going to take upwards of, I've seen as much of a week for some public testing locations to actually get the results back. The return to work for that for an employee with a positive test is going to be pegged to the date that specimen was collected. So trying to get your testing done as quickly as possible, it's going to be pretty critical for you as an organization for business continuity. It's also going to play a key factor in developing the timeline of potential exposure of other personnel who came in contact with that employee for a certain period of time, and developing the profile of other potential close contacts that would also need subsequent testing as well. Again, if there's other questions on that, I already see that we have a couple questions coming through around that. We'll talk about that. But also reach out to us if you have specific cases and need some help navigating those outbreaks or cases to keep them from being outbreaks. Now we're getting into those other specific example or specific scenarios where Cal OSHA has layered additional requirements depending on the extent of outbreak that you have within your workforce. So that first category is if you have multiple infections essentially a window of 3 to 20 for this first section right here. What are the expectations around response, testing, record keeping, reporting, etc.? Not going to dive into every single line item on this, but just know that if you have the threshold is if you have 3 employees on a work site, not necessarily a company, but if you have 3 employees on a work site that test positive, it starts to layer additional requirements of how you respond to that. The next category for that, and within a 14-day period, just to have a caveat for that. So three cases within a 14-day period, up to 20, which brings us into the next category, which is what CalOSHA is considering a major COVID-19 outbreak, where you have 20 or more confirmed cases on a work site. Now, taking a minute to talk about what we mean by work site. When we get into, for example, this major COVID-19 outbreak, we're talking about 20 or more confirmed cases within a 30-day period on a work site. The example that we have here in the building that I'm sitting in right now, for example, is we share this location with 4 other companies, and all of us interact company to company, business to business, in support of the Builders Exchange and the work that we do for the construction industry. So theoretically, if I had 2 cases in my operation or within my company, and then there was another case in another company, and we had potential exposure in common areas like our conference room, the common restrooms, etc., that would be considered a multiple cases within the work site, even though it occurred between multiple companies. So it's not company specific. There's also benefits to that work site definition as an individual company. So for example, if you're a trucking company, this is actually an example that we talked about in the morning session. If you're a trucking company, as you were developing your COVID-19 prevention plan, and you were very clear on the scope of how you were managing the configuration of your work sites as a company to maximize the amount of, or minimize the amount of time that your drivers are coming into the central office, and essentially establishing their work site as being their truck or wherever they're traveling as part of their responsibilities for as a commercial driver. And you're also demonstrating within your prevention plan how you are minimizing the interaction from driver to driver. You're essentially helping outline the case to where if you do have positive cases within your driver workforce, you don't have overlapping work sites, because you're essentially eliminating that exposure potential and how you're configuring your plan, and making the case of being able to demonstrate that no, this case over here is a different work site. It's not considered an outbreak because there was no exposure from this work site to that work site. The same goes for companies that work for multiple general contractors. Being able to demonstrate how you're segmenting your work sites and the crews working on those work sites in order to minimize the impact of having your entire company rolled into close contact tracing and potential exposure and testing. The last 2 categories, talking about prevention specific to employer provided housing. I'm not going to go into too much detail on this. If you are an employer to where this really does apply to you, and how what considerations are going to be put, or controls are going to be putting in place for that housing, which if you do have housing, that is going to be a pretty high transmission potential. But again, fortunately, not too many companies here in California are having to deal with this. It's this next category with the specific requirements around employer provided transportation to and from work. And this doesn't mean only having employees that have a company vehicle that they take home and for commute. A lot of COVID transmission that we're seeing is occurring in company vehicles, because when you look at the factors involved, you have close contact because you can't be with it. You're going to be within that six foot space anyways. Lower frequency or likelihood of people wearing masks just because of the aspect of complacency of I've been driving with the same group of individuals day in and day out. I'm going to take the mask off. During the heat of the summer and the cold of the winter, turning on that recirculate function for your climate control, and then just recirculating the air within the vehicle. That's really making sure that if someone was positive within the vehicle, that everyone else would eventually become positive within the vehicle. So there's some guidance that has been put out that is specific to how do you manage that exposure and transmission potential in your company provided transportation. So with that said, that's the meat and potatoes of the guidance document. Again, this is available to everybody as a starting point for putting your plans together. If there's anything that we can do to support your organizations with writing plans, supporting your audits, anything else, please feel free to reach out to us. But this is a free guidance document that we put together just for the greater good for everybody. And please don't hesitate to reach out if you have any questions. So with that said, we will dive into the questions for this session. All right, let's see what is waiting for us here. Okay, awesome. All right, running through these, and then we'll turn it over to the HR side of it. First question: helping outline responsibilities for multi-employer job sites in the event of an outbreak. Who calls the health department? OSHA says it's now the employer that has the responsibility, but what about when you're the general contractor? Do we call, or does each trade call, and who is impacted by the cases? This is a very thoughtful question, so thank you for that. So we're touching on the reporting requirements when you do have a outbreak. So we talked about the multiple cases of 3 or more, and then the 20 or more major outbreak, et cetera. And the way it's written is having to, there's a reporting element to that. But the question here is, as a general contractor that has responsibility and oversight for the contractors and subcontractors working on my work site, in the same way that I would have responsibility and oversight for fall protection, if we're doing any sort of work at heights, silica exposure, et cetera, there's a shared responsibility there. So what I would, for this particular example, the guidance that we've given in the past has been, go ahead and just layer the reporting. As a general contractor, technically you would be able to point to say that, no, it's the employer that is responsible for the notifications. But then as the general contractor, knowing that that reporting has to happen anyways, and being able to show that you are being proactive about it, if there was any that you're being proactive about managing your site holistically. I would encourage you to also coordinate that reporting at the same time, because what's going to happen is, if you are a general contractor and you have one company who is doing everything that they should do, they have a solid plan, all the controls are being followed, et cetera, but then you have another contractor that may not necessarily be as developed in the way that they've of creating a plan and making sure that those are in place. If OSHA is going to show up, or if it's going to be looked into anyways, you as the general contractor, you're going to want to be able to show that you're helping coordinate and manage holistically. And by taking a backseat approach to that, it's likely going to end up falling on you in the first place. But even more importantly, as the GC, you want to be ahead of the curve and be providing the guidance to your to your contractors and the subs that are working on that work site to say, here's the baseline expectation that being on this work site, we expect you to have in place. That is a responsibility that you have as the GC, ultimately responsible for COVID transmission within that site. So one thing that you can do is, for that, as a general contractor, as part of your COVID prevention plan, write your COVID prevention plan in a way that you can also tailor it as a site-specific plan. To be able to say, okay, for this site, this is how we take these controls, and this is where these controls apply on this site. So for example, portable restrooms on a work site. In your COVID prevention plan, you will have the guidance in there talking about what is required for disinfection of portable restrooms, having some general statements around making sure that you're potting the people who are using this restroom versus that restroom. Your site-specific plan should be written in a way that is specific to, say, companies A and B, you guys are using the Southwest portable restrooms. Companies C and D, you guys are using the Northwest. And then that way, if you do have an outbreak, you can demonstrate that you're managing the potential of transmission between contractors by separating where are those transmission points. And then if you do have a outbreak in company A and B, you don't have companies C and D also getting looped into that close contact shell and then potential exposure and testing requirements, et cetera. So all that to say, as the GC, yes, there's responsibilities that your contractors have, but you really want to be ahead of the curve by setting those baseline expectations, because you have to write your own plan anyways. As the GC, you might as well also apply that to your contractors as well. Cal OSHA exclusions say that an exposed employee needs to quarantine for 14 days. What if we send that employee to be tested and they're negative? Can they come back to work before the 14 days? Okay, so there's a difference between going and having a health agency or a medical provider order isolation or quarantine for an employee versus if you have a confirmed case and then you have potential contacts who also need to be tested as well. It doesn't go straight to those close contacts have to be isolated for 14 days. They have to get tested, and you can essentially test them, and if they test negative, you can have them return to work also, as long as they're not showing symptoms either. So it's not an automatic 14-day, but you do have to be able to show here's the confirmed COVID case that we had, and then based on the controls that we have and how we've been able to demonstrate who are the likely employees that potentially have come in contact with that confirmed case, here's who needs to be tested, and then here's everyone else who isn't getting pulled into that potential exposure, because you have a plan that helps make sure that you're minimizing, and you can show through documentation that these employees have not come in contact with these employees or this employee in particular. But to answer the core question here, it's not a blanket 14-day unless a health agency or medical provider is requiring that person to quarantine for 14 days. At that point, it's out of the hands of Cal OSHA and you. We are a service-based business. We see several customers a day. How do you recommend we protect ourselves from exposure around our customers? So pretty general question. There's quite a bit to cut through on that, but what I would say is, if you have an aspect of potential exposure from the public because you're a service organization compared to a business-to-business organization, what I would encourage you to do is look at where those potential exposure points with the public, and what controls would be specific to a employee to public interaction versus employee to employee interaction or employee to another business interaction, like on a multi-employer work site, et cetera. Because there's certain things that you don't have as much control with dealing with the public as you do with dealing with your own employees or dealing with other contractors on your work site. So without knowing the specific details around your business, the type of work that you do, et cetera, I would, if you do have a public interface component in the type of work that you do, outline that specifically within your prevention plan to say, when it comes to us interacting with the public, these are the steps that we take in order to prevent having COVID be transmitted into our workforce from a public channel. Jason, can you repeat what you mentioned about respirators? Do we need to have it in our CPP? So depending on the type of work that you do, or let me back up. Your COVID prevention plan needs to address face coverings. It doesn't necessarily need to address respirators if you don't already have a requirement for respirator use as a company. So for example, if I was a concrete cutting company that had a silica exposure and required respirators because of the type of work that we do, that is something to where you would reference instances to where the respiratory protection that's being used for this operation also meets the requirements of face coverings for COVID prevention. And then you would be able to outline where does that apply and how does that link up with your respiratory protection plan? Because what you wouldn't want to do is just make a blanket statement to say, okay, well, now everyone in our company is going to wear N95 masks, because then that would trigger having to put those personnel wearing N95 masks into your respiratory protection program when the standard face covering would meet the expectations of your COVID prevention plan. And that's really all they need for the type of work that they do. So if you do have a respiratory protection program, be able to give a few lines in that plan to talk about how does that align with your COVID prevention plan and what type of respiratory protection is being used here, to where you can also count it for your COVID prevention plan. And then outside of your respiratory protection program, where our face covering is being used, to where you're not having to have employees get rolled into your respiratory protection program just by virtue of the type of respirator or having to use a respirator like an N95 mask. Do employers have to pay employees for quarantining at home? I'm going to leave that one to Christine. She will talk about leave, pay, etc. Let me clean up some of these just to make sure. There we go. All right. Scenario: 2 guys working together outdoors on site, both masked all day. One tests positive, one tests negative. The positive one is out for 14 days. Does the negative test get to return to work? Or is he out those 14 days as well? Because this goes back to what I mentioned earlier. It depends if he was ordered to isolate or quarantine because of the exposure. But if they test negative and they're not showing symptoms, as soon as they have that negative test, then they're able to return to work. Christine's going to talk here in a little bit how you can't go back and then require a negative test from someone who was positive in order to return to work. Just keep that in the back of your mind. That's a different circumstance. But if you have a positive case and then you have a potential case of someone who may have been exposed to your employee, that negative test by that employee for that employee is part of the justification for them to return to work. Now, if you take a look at that question and what you talked about in there of you have 2 employees on the work site and you can demonstrate that they have not come within 6 feet of each other for more than 15 minutes within a 24-hour period. And the other employee who did not test positive is not showing any symptoms or anything either. Depending on how well you write your plan and how robust your organization is in following those controls and requirements, you may not even have to have that other employee be pulled into testing requirements if you're able to demonstrate that, nope, we're managing this to where they're not going to be coming in contact with each other to meet that close contact definition or that exposure definition. And then here's the other things that are in place to further demonstrate based on the inspections and everything else that we have the justification to say that these employees do not need to be tested or temporarily quarantined because of these controls that we have in place. That goes back to the value of taking the time in creating a plan and having your workforce follow that plan, because if you do have a case, it helps with business continuity to not have everyone just get rolled into the same testing requirements. The employer only has to pay for testing for the workers that were exposed to an employee who reports that he is positive. Okay, so unless I'm misunderstanding the question, when it comes to testing, the employer has to provide that testing. Fortunately, there's plenty of free testing resources out there, but then it's a question of how quick you're gonna get those results, and is it worth it to pay for testing with a medical provider in order to get turnaround faster on those results. That's going to be a business to business decision on that. But I generally what we've been seeing with companies is that they're willing to. You have to provide it as the employer. You can provide it using free resources, or as an employer, you're going to lose a lot more money waiting around up to 5 to 6 days for test results, like we've been seeing in the last few weeks, than you are of being able to go down and pay to get a test that's going to yield faster results. But to answer what I believe the question is, the employer is the one providing it. Do we have to inform customers if we have one positive case? Is there a minimum based on reporting? So that's a little broad, and it depends on what we mean by customers, et cetera. But in general, when you look at the guidance document in there, there's very specific circumstances of what would be considered a potential exposure. So depending on how your customers are interacting and how you're managing the interactions with your customers, is probably the better way to phrase it. If that interaction is not meeting the definition of what would be considered a close exposure, then no, you don't have to go and do any sort of contact tracing or exposure notification to your customers beyond that. Same applies to your employees as well. If you're managing your COVID prevention to where you're limiting those interactions and potential transmission points and exposures to where it's not meeting the definition of requiring further testing, et cetera, then by you being proactive by it, it's going to help you with business continuity on the back end. At what point does a COVID-19 incident become a OSHA 300 log entry illness? So it's a recordable. It meets the thresholds for recordable illness. From there, it's a question of work relatedness, and this goes back to depending on the circumstances of the exposure, who tested positive, the results of your contact tracing, et cetera. But more importantly, the plan and the results from your inspections and assessments that's demonstrating that your controls are working will help you if there is potentially a justification to say that the COVID case is non-work related. It just helps set you up for success for that. But then again, there's also been there's been a lot of guidance that's come out from OSHA and directives around presumption of work relatedness and a certain sequence and logic that you have to apply in order to be able to get a exclusion to have it not be considered work related. It varies circumstance to circumstance. So again, if you do have a specific case or questions on that, feel free to reach out to us. And then it's a matter of walking through of what are the circumstances to see if it's going to end up on the OSHA 300 log or not. What about outbreak? Doesn't OSHA outline that all exposed employees need to be tested and quarantined? I think we. Oh, okay. I see what you're saying. You're talking about under the outbreak circumstances, not for the individual. So depending whether you have the 3 to 19 cases within 14 days or the 20 plus. It goes back to how are you defining potential exposure, and then whether those cases have symptoms or not, and then the return to work criteria that you put in place as part of your plan, and making sure that it's meeting the minimum requirements for return to work requirements for Cal OSHA. So again, it's not a blanket, hey, if they're considered exposed, it's 14 days quarantine right off the bat. It depends on how you're setting yourself up for success in the way that you write your plan to not have everyone get grouped into that category. And then also going through and having a clear return to work procedure for those employees as well. Do employers have to report confirmed cases of COVID-19 to OSHA if there are only 5 employees? I'm assuming the question on this is only 5 employees based on the size of the organization. The size of the organization doesn't factor in. If you are meeting those requirements for outbreak 3 or more cases within 14 days, you do have to do that reporting. So theoretically, as a 5-employee company, if you had 3 cases on the work, and it also goes back to work side, you can meet that 3 case threshold as a 5-employee company that would require that reporting back to OSHA for an outbreak. All right. And I think that's it for questions on this end. Good. Okay, cool. All right. I will thank you all for that. I will turn it over now to Christine for the HR side of it.
Perfect. I got 10 minutes. No, I'm kidding. So we're going to take, again, as long as we need to cover a lot of the HR because, It's tough, especially we get a lot of emails here going, hey, it's changing so much. How can I keep up? Or, it's what we say today could change Monday, So we have a lot of changes going on, and it is definitely hard to keep up on a lot of this stuff, and that's why we're here to try and help you out and help you stay on top of this. So really quick, I'm Christine Odell with Absolute HR Consulting. We work closely with a lot of the exchanges and try and filter out keep you on top of a lot of this information. So even after this seminar, there's probably tricky scenarios or situations that you might be in. Please feel free to reach out to us, whether it's with us with Absolute HR or Jason with Arthur and Hanson. We're here to help you navigate through this. And again, each situation's different. There's all these different scenarios. So we're going to I'm going to try and cover the common things and show you some really great resources for you as well. So one thing I do want to share, if you haven't been here before, on the COVID-19.ca.gov has a really good resource on here, and it links you to not only the state, it links you to EDD, DFEH, Department of Labor, a lot of stuff. And so if you're on this website, there's some really good resources when you scroll down for businesses. How can I safely open my business? If you click on this, there's a lot of links and everything here for you. There's a blueprint for a safer economy, which is a kind of a handout in here, and you talk about your county. You have the employer's playbook, which is a really good resource that adds and supports a lot of the questions that probably a lot of you have in different scenarios. And then also how to respond to COVID-19 work cases. So when you are looking at this, down towards about midway here, here is kind of some stuff that Jason had talked about, different testing, how long they need to be quarantined. There's symptoms that have tested positive, no symptoms that still test positive. What if they've been in close contact? Different things like that. So this gives you when the minimum criteria to return back to work. Okay. And it also links you to the CDC websites as well. Okay. Another really good one is that I know a lot of people will have questions on is the COVID-19 sick leave. We're going to cover this a little bit more too. This compares the different types of sick leave that are available to employees, and it talks about the qualifying reasons for the leave. Okay. So employers hiring, entities covered, workers covered. Okay. Who's covered and what type of pay. So this is a really good reference for you. It's a quick reference, but what's nice is, okay, if we fall under this leave, then you know how to look up that leave, and it will go into more detail also. So this is just kind of a quick synopsis of it. That's a quick reference for you. The other website that I have up here is the Department of Labor website. And this is their website dedicated for COVID-19 that talks about that FFCRA leave that we're going to be talking about here in a minute, the temporary rule, your fact sheets for employers, plus your required posting. So all employers are required to post the FFCRA leave. And also, when we're talking about this leave, it applies to all employers. It does not matter how many employees you have. It applies to everyone. And then here's a frequently asked questions page that's really good to pull as a reference. There's about 100 different questions. And right here is your posters and such for your postings. And you need to have these posted at your facility or at the job site where employees report to. Okay. So just wanted to share those quick websites with you. But I want to answer a lot of the common questions that we have coming in, the frequent questions, and then I'll start taking Q&As here in just a little bit. So some of them is, may an employer ask employees entering the workplace if they have COVID-19 symptoms? Yes. So, and when we're talking about symptoms, and it's 'tis the season that we all start sniffling or having a little bout of something, the COVID symptoms are congestion, like chest congestion, temperature, a cough the cough, I think, is kind of been the more common one I've seen around with people that have symptoms. Now, we also need to remember that employees might not have symptoms and be asymptomatic as well too. So if you're an employer and an employee comes in with symptoms, send them home. Either have them quarantined for 14 days or get tested, okay, and see what happens with the test. Can employers take employees' temperatures? Yeah, you can, okay. It's good, make sure you keep a record. You don't have to keep a record. I think Jason had mentioned that earlier, but it's a good protocol for you. May an employer require employees to submit to a medical test to detect the virus? Yes. So a lot of employers, and especially with the holidays, are implementing kind of more travel restrictions or requiring employees that travel out of a certain area, whether it's out of state or even a long distance. They're requiring their employees to either quarantine for 14 days or when they return, typically the waiting period. So what the guidelines are is if you've been in contact with someone or possible contact, it could take up to 3 days for a test to be positive. So as an example with us, we have if employees travel out of state, when employees return, they need to wait 3 days and then get tested before they can return back to work. If an employee does not want to get tested, then we require them to be quarantined for 14 days, okay? Just like for anyone that might be in the Santa Clara County area, Santa Clara County actually has implemented for all their residents, if they travel 150 miles outside of the county, they're required to quarantine for 14 days. Okay. May an employer ask employees why they've been absent for work if they suspect it's been for medical reasons? Yes. So if employees have called in sick or been out for an extended amount of time, you can ask. There's been some quick questions such as one employee called in sick and then he's been MIA for several days and we haven't heard from him, and he called in sick and thinks he has COVID and it's been almost a week. Well, that you don't know if they have COVID. I'll talk about how to pay employees that have COVID or strictly call in sick. May an employer send employees home if they display COVID? Yes. May an employer send employees home if they test positive? Oh yeah. So you definitely, if you've got someone that's kind of coughing or sitting there, because we're finding employees are testing positive because they're sharing rides or gatherings with family. It's not necessarily travel that we've seen this spike. It's more people going to family and getting it from family or friends from events. And then they're passing it along to people that they might be sharing vehicles with or something too. So if someone is coming in and you notice that they're coughing more than usual, I would recommend getting them the heck out of there. So get them out of your location. Okay. What information can an employer reveal if an employee is quarantined? So if an employee is tested positive, you need to do your contact tracing, but you can't tell your other employees who it is. So we still need to maintain privacy. And also if they were involved with any customers or any vendors, you need to do that contact tracing, that look back period, and inform anyone that they may have come in close contact with, that let them know you may have been exposed to someone that you have has tested positive, so you need to go get tested. Okay. Now with FFCRA leave, let's talk about that for a minute. So the FFCR leave applies to all employers. And what that covers is anything that would be related to COVID-19, so that an employee is out of work. So if my employee called in sick and thinks they have COVID and goes MIA like this one, they don't get FFCRA leave. So in order to be eligible for FFCRA leave, they need to seek medical attention. It's not a simple call-in saying they're sick. So as you as an employer, for anyone that believes that's showing symptoms or getting tested for COVID and is requesting the FFCRA leave, you need to document that. So what you need to document is you need to have the name of your employee that's requesting the leave, the date that the leave is being requested for and required, the reason for the leave, and a statement from the employee that he or she is unable to work because of that reason. So we have a couple checklists and templates that we will share with you guys when we send out the recording and some additional documentation. So that'll help you. So you need to have a statement. Now, what happens as an employer, if you pay the FFCRA leave, you are receiving a credit back for that from the Department of Labor. And you need to retain the records, the statement from the employee and such for 4 years. And what happens is if there's ever an investigation by Department of Labor regarding the leave or the employee's request, the liability is 100% rests on the employee, not on you guys. So if the employee committed fraud in a statement, then they're held liable. Now, the request has to be submitted to you. It's not that they call in and ask for it and disappear. So you have to approve it. So if an employee calls in sick and thinks they have COVID, and a couple days later they're posting on Facebook or social media that they're in Vegas, that will deny them the FFCRA leave. So you have supporting documentation and proof in some way that they are out, that they are not under a quarantine, okay? The FFCRA leave is also eligible for employees that are told to quarantine by a health official. So sometimes we had an example in our last seminar that someone's roommates tested positive and they went and got tested themselves and they tested negative, but the healthcare professional told them that they needed to quarantine for 14 days, okay? Even though they tested negative. They will be eligible for FFCRA leave on that because they sought medical attention and was told to quarantine. Now the FFCRA leave there's two different parts of it. One's the paid sick leave. That is up to a maximum of 80 hours, and it does not reset. So the 80 hours can be taken for the employee out on COVID or a family member that they have to take care of. Maybe it's a child that has COVID, or it could even be an elderly or disabled parent that lives in the household. It's got to be someone that lives in the household, okay? Someone that can't take care of themselves. It's not 80 hours for them and then 80 hours for taking care of someone else. The 80 hours is a max, okay? Now this leave does end. It's set to expire December 31st. It has not been extended yet. There has been intentions and kind of they anticipate Congress extending it. If Congress doesn't extend it by the end of the year, Biden, that comes into office January 20th officially, has noted that it will most likely be extended. But as of today, it has not been extended past December 31st. The other leave that falls under the FFCRA leave is for children that are at home. For daycares closed or schools closed, and there's no one else to look after the children. That's up to 12 weeks. So, but it's combined. So if someone was out on COVID leave for 2 weeks, then it's only 10 weeks for the child care. So it's up to a maximum of 12 combined. Now, the 80 hours is for full-time employees. Part-time employees, it's up to 2 weeks, but it's up to whatever their average week hours are. So if they only work, say, 24 hours a week, then they're going to have a max of 48 hours. So it's based on the weeks for you. And that's also kind of defined a little bit more detail on the Department of Labor website as well for you. Now, employees that are not eligible for FFCRA leave are ones that they say they have COVID and don't seek medical attention or anything. They just go home. Also, employees that might be out on workers' comp or currently out on disability and they now test positive for COVID, they're not working, so they're not eligible for the leave. So you as an employer must be open and the employee able to work to qualify for the FFCRA leave. So we have these shelter in place coming in. If you are a non-essential company that ends up closing because of the shelter in place restrictions, when you're closed, there's no FFCRA leave. So even if you have an employee that's out right now and maybe they're a week into that leave, the moment you close, or if you typically close for a holiday, they don't get paid during that week because the company's closed, okay? The company must be open. With the leave, I had seen something pop up really quick on the child care. Let me show you where that is a little bit more right here. So you can take up to 2 weeks, okay, of sick leave, which is for you or for another individual, such as a parent or someone that needs your help. And then there's the expanded leave, which is up to 10 weeks when a child's daycare or school is closed. Now, if you're taking this leave, it's only for one parent. So both parents can't take the leave off simultaneously. Now, I've seen where some parents take it intermittently. So one parent will maybe take it 1 week and another one the next week, or they'll alternate days. Maybe one might take a couple days off work and the other one takes the other ones. So it's only available for one parent at a time. Both parents cannot take that leave off. Okay. Let me see if I had any other questions on this one. I think that was it. Employees cannot collect work comp and unemployment at the same time. So if an employee has already exhausted that full 80 hours, so maybe they were in close contact at one point, had to be under quarantine for a while, and then they've are out of quarantine, and now they've tested positive and have to be under quarantine again. Once that 80 hours or that 2 weeks is met, it's done. They are not eligible for more. So now what they will apply for unemployment or pandemic assistance or disability, okay? But they can't collect unemployment and the FFCRA leave at the same time, okay? A couple other questions that had come in earlier is, do we have to shut down if we have an employee test positive? So that was kind of covered a little bit under by Jason, and it's as a case by case kind of needed. And again, you know, when there's something specific to your company, it's good to reach out to us because everyone has a different situation or scenario, and we can, you know, there's no way for us to cover all of it in this thing because each one's a little different depending on where the cases are, the contact, anything like that. So let me take a look at a couple of the questions that have popped up here for us. So how many days do you have to be out to qualify for leave, and what coverage do you qualify for if childcare closed? So I covered the childcare. The days to be out to qualify for leave is the moment you go see. So not necessarily a medical provider, but the moment you go, if you have symptoms and you go to get tested, that's what triggers that leave. So when you go to see a medical professional. So there is no essentially downtime on it. Someone had asked earlier in our other seminar is they had actually a scratchy throat. It was before Thanksgiving, had a scratchy throat. So the employer had sent them home. They didn't feel better after Thanksgiving, and it was really sore throat. So they went and got tested. They tested negative. They came back, they went and saw a doctor, and they had strep throat. So then they've been out for a month because of strep throat. That's not FFCRA leave. That doesn't qualify for it. What qualifies for the FFCRA leave in that situation would have been when they went to get tested, and then when they received the test results, it was a 3 or 4 day lag. They got paid for that. Okay. As an employer, you know, I don't give too much pushback. If your employee has symptoms, send them and get tested, pay for the leave. Okay. Because it's not coming out of your pocket, and you will get a credit on that when you file your quarterlies and stuff. So that will all get reimbursed. But again, the employee has to request it. Don't just automatically give it to them. They need to request that leave, and you need to get a statement from that. Do employers have to pay employees for quarantine at home if they traveled for leisure against the state's recommendation? No. So if they're under quarantine, and even if you tell them, hey, you travel out of state, you have a travel policy, and they come back and you say you need a quarantine for 14 days, that's not going to be paid, or if they quarantine themselves. So the pay for the FSCRA leave is for them to go see someone, okay, and be told by a professional that they need to be quarantined. Okay. Someone's asking for the website earlier. The website that we had, the first one, I believe the one you're looking for, is the covid19.ca.gov. And that brings you to this landing page here. There's a lot of great resources if you haven't been here before, okay? The other one is through Department of Labor. Okay. We have an employee with a spouse that is expecting a child in January. Their OBGYN and hospital are requiring his spouse and him to self-quarantine for 2 weeks prior to the expecting date. He's not eligible for FMLA leave as he's only been employed for 60 days. How do we handle his pay? What happens if the expecting date is longer? Do we still provide after that, and how long? So here's the thing. Right now, FFCRA leave expires December 31st. So the professional is telling him he needs to quarantine, so he'll be eligible for FFCRA leave, but right now, only up till December 31st. And then we'll have to see what happens if it gets extended or if there's any changes to that. Okay. So right now, it's just the 2 weeks. Okay. Who pays for the test after their travel? So most testing centers are free, but if the employee, if you have a policy that employees need to quarantine, and this is what I recommend, is establishing a policy that if they're traveling, especially out of state, and people going into some like my in-laws I haven't seen for quite a while, and they live in Wisconsin, and that's a really hot state right now, so we're not traveling there. They pay for the testing if they want to get tested. Otherwise, they need a quarantine for 14 days. Okay. If an employee travels out of the state, should the employer ask for proof of return date into the state to determine the 14-day quarantine? Yeah, if you're closed during the holiday and you are opening back up, say on Monday, and that's when employees are expected to come back, then I would do the 14 days. It's kind of a trick thing there. It's up to you guys. And ideally, if you're practicing safe protocols and social distancing and your mask wearing and stuff, the 14-day quarantine is just kind of that buffer to make sure everyone, symptoms will, if someone has symptoms, they'll usually kick in within a few days. So just kind of keep an eye on your employees. From CDC travel site, if you're traveling, consider getting tested with a viral test 1 to 3 days before your trip, and also consider testing 3 to 5 days and reduce non-essential for 7. If you don't get tested, consider reducing non-essential activities for 10 days. Yes. So, and that's what I was saying, when someone comes back, you don't want them being tested immediately. If someone tests, it needs to be at least 3 days out from when they come back. So, because we had one person tested at negative one day, and the next day they tested positive. So you need to be sure that you're quarantined. Okay. And, everyone knows from when we started this, back in March to now, everything's changed. We've gone from 72 hours to 24 hours to come back. Employees. So Jason had mentioned earlier, employees that have been tested positive and told to quarantine, they're usually working with a healthcare provider and letting them know when to come back to work. You can't require a negative test for them to return back to work after testing positive, because there's a lot of guidelines depending on their symptoms, if they were symptomatic or asymptomatic. And a lot of people will continue testing positive for, I think I've seen almost 60 days that we've still had people test positive. So if the healthcare provider is releasing them back to work, and typically it's 10 days from when, again, it goes back to if they're asymptomatic and they go get tested and test positive, it's typically 10 days from when they got the test. If they're symptomatic, it's dependent on their fever and symptoms when they start improving on that as well too. So if the test is negative at day 3, do they get to come back to work, or do they have to wait the 7-day period? So if they wait, the recommendation is, I'm assuming if they're traveling out of an area, when they come back and they wait the 3 days, get tested, typically they get tested. You don't want them coming back until they get their test back. So that's almost your 6-day travel time, right? Your 6 to 7 day period that's coming in. So when they go to get tested after 3 days, the results are averaging 3 to 6 days to get the results in. So you don't want them back until they get the results in. If they have symptoms, test negative, then retest at the end of their quarantine and come back positive, do they have to quarantine again? Yes. Okay. So provided they are no longer symptomatic, if they test positive, they need to go by what the healthcare provider tells them. So anyone that tests positive or even been in close contact, the healthcare, whoever they're working with or is in contact with, will tell them to quarantine, and we'll let them know how long they need a quarantine. That we don't have a say-so on. Does the 10 days paid expanded family leave only apply to larger companies? No. So the 10 days expanded leave, the FFCRA leave, applies to everyone. Everyone. Doesn't matter. You can have one employee and it applies. Okay. Oh, the 10 weeks. Sorry, that was the next one. So the 10 weeks for the child care also applies to small employers as well. Now, if you can allow someone to remote work, that's a nice, easy way. A lot of companies are doing kind of a mixed. If an employee has daycare issues, they can remote work plus do partial for FFCRA leave as well. So that's another one that you can go for. If an employee gets tested and tests negative, do they get their full pay for the days they missed or the 2/3? So the full pay is the sick pay. The 2/3 is for childcare. Okay. So the 2/3 pay is going to be for childcare. Okay. I think, did something else pop up here? So there's no max time to be out. If they're out and get tested and get negative and it's been 5 days, they are still covered. Yes. So there's no, well, the max time to be paid is going to be up to the 2 weeks. Okay. Now, we've got the 2 weeks, and also you need to provide, if you provide health insurance for your employees, you still need to maintain that health insurance. And there is leave credit for that as well to help with the health insurance. Okay. We had a lot of good questions. Any other quick ones before? I know it's a lot and we have a lot that's just coming in. So again, we're gonna have this recording. We have some additional documents that we're gonna be sending out for you. Check out those websites and the information that we have, because I know that'll answer a lot of the questions too. And with, I don't think we have it, so we'll put them in here. For me, you can email me at Christine@absolutehrconsulting.com. So I just sent that in the chat. And then Jason will put his email in here, address for you as well. So we're on the HR side and you can ask him on the safety side. We had a quick question, a couple questions. What responsibility does the employee have in regards to reporting their symptoms? For instance, if they come to work sick and don't tell anyone for the entire day and the next day test positive for COVID. So we're actually starting to see people report to work knowing they've tested positive. As an employer, if we see someone that has the symptoms, we need to get them out of our office, okay, or get them off our work site. We can't have them come in there if there's some. Now the asymptomatic, we don't know, but again, that's where we need to make sure we're reinforcing and taking our safety measures, making sure we're cleaning, washing our hands, sanitizing, wearing masks. If we're in close proximity of each other, we need to make sure we're wearing masks at all times. So it's very important, but Employees are putting people at risk. We've seen some employees come in that knew they were positive and have gotten others infected that have underlying health conditions. So we need to really push that as an employer and think of the safety of all of our employees. What proof is required to justify their 10-week childcare leave at the 2/3 pay? So we need to get written proof, and I will actually send you the checklist and some a sample form for the employee to fill out, but they do need to complete, provide you a written statement. But for the FFCRA leave, it's simply a statement by the employee. They don't have to produce a copy of the testing. They don't have to produce any kind of supporting documentation. It is simply a statement from the employee. For the child care, it's going to reference what child and the facility and such as well too. So we've had some employees that have asked for full days, but the schools were in half days or rotating. They had Monday and Wednesdays. And so Monday and Wednesday, the employer expected the employee to come to work, and Tuesdays and Thursdays, the employee was expected to go, was paid the FFCRA leave. So it's kind of documenting and getting all that from your employees as well. Okay. I'm sorry, we tried to keep it down. We did a little shorter this time because I think we ran along pretty good. So again, if anyone has any questions or any situations, we'll be sending everything out at the beginning of the week. So we're going to send it to the email addresses that we have on file. And if anyone didn't make it, we'll send it to them as well too. So everyone have a great Friday and thank you.
Thanks, everyone.